discuss the department's state of health. We are joined now by the Health Minister, Dr. Aaron Motsoaledi. Good evening, Minister. Thanks very much for joining us. Well, if I may just start from where the Ombudsman said, he was quite scathing. He spared no one. And I suppose that's the reason you appointed him in the first instance.
Precisely, Vuyo. That's the reason why the Ombudsman was appointed. Because in 2010, we did a survey. We wanted to do an audit and a survey of all the public health facilities in the country. And we're checking 6 things. We're checking cleanliness of the institution, the attitude of staff to patient, the safety and security of patient and staff, the long queues or the waiting times, the drug stock outs, and infection control. These were 6 things. And out of the 6, we found that the worst outcome is attitude of staff to patients, the way the staff deal with patients. And we realized that all 6 of them, especially the issue of attitude, they need a structure, a permanent structure that deals with them. And I then came up with an idea of Office of Health Compliance. But we're also coping. After a crisis befell Britain some years ago, they came with a structure called Quality Care Commission. So we established that structure here. We call it Office of Health Compliance. And the Ombudsman is a member of that office. When I launched the Ombudsman's office in June last year, I said it's the public protector of health, so that people must report issues to him, because I was worried that people who have been hard done by the system, they come to the media and it's reported maybe for 1 day as headline, then it's forgotten, it passes, and there are no consequences. And so I wanted an office where there will be consequences. And it so happened that immediately after appointing that office, 3 months later, the issue of life is demand happened, and the office became handy, very handy, as you know by now.
Now, he was sitting in that chair about 30 minutes ago, and he was scathing about the things that he has already found. Yes, he says a lot of them still need investigation, but there's prima facie evidence that there is so much wrong going on. That doesn't surprise you, does it?
No, it doesn't. Not at all. That's why I'm saying we established that office to do exactly what it's doing. And we're happy that it's doing that work. When they started investigating life is the main, people thought maybe we're going to push something under the carpet, we're not going to be transparent, we're going to be in denial. But you know the results now. And I said, he is doing exactly what we asked him to come and do in order to improve the public health system in our country. And I saw there you were saying the health system was regarded to be the best in the African continent. It still is, for your information. And you said it still is. That I can assure you.
But why are you basing that on?
No, we meet all the time as ministers of health in the African region, especially within the World Health Organization, Africa region. We meet, we have got summits. And you hear when your fellow ministers are talking, or when they look for help. I mean, even now, Vuyo, most of the deliveries that happened in South Africa in our public health system is from people who are not from South Africa, who are coming here specifically to look for health services. You may remember last year when there was a big halabaloo about a woman from Burundi who delivered a baby at Park Station. And they were saying it's xenophobia. And I disclosed that the hospital, one of the hospital accused was Charlotte Maxeke. And I reported that it had just delivered 700 women that month. And 400 of them were not South African at all, were people who are coming here to look for health services.
But being better than others doesn't necessarily make you the best.
No, you were comparing us with the continent. I was talking about the continent. It depends when you say the best, who are you comparing us with? I was talking about the continent. Of course, we are not where we want to be, because they are, to really be the best in healthcare system, What we need to do is to implement universal health coverage, or NHI. Because how did NHI come into being, Vuyo? Because the World Health Organization and United Nations realized over the ages that whatever measures you put to improve health don't work, because as long as you have got a health system for the rich on one side and healthcare system for the poor on the other. And that type of system is much more prevalent and sharp in South Africa than in any other country in the world. And that was not said by me. It was said by the World Organization when they were presenting to Chief Justice Mvoko about the cost of private healthcare system. They said there is no other country in the world except South Africa where so much money is paid for the health of so few people. And then the majority are getting very little.
From what the Ombud was telling me, South Africa's private healthcare system is no better. He reckons it's worse, that the atrocities going on there, being committed there.
Well, I'm happy that he's the one who's saying so. I've been saying so for ages. And everybody was saying, no, don't touch private health. There's nothing wrong with it. It's perfect. It's the public health. So if the Umbud said so, I didn't hear him. I'm very happy because I've been saying so from 2009. And even talking about the cost, that the cost of healthcare is ever escalating for a few people, because the healthcare system in South Africa is already spending 8.5% of the GDP. That's what we're spending on health. But then that's a lot of money. Many countries are still lower than that. So where is the problem? Because 4.5% of that is spent for only 16% of the population. And the remaining 4.1% is spent for 84% of the population. That's why we've got 1.2 million pregnant women every year. But the private sector, with all those amounts, huge slice of the GDP, is treating only 140,000. The whole 1,063,000 still have to come to the public sector. Let's look at the biggest disease in our country, HIV and AIDS. We have got 4.2 million people on treatment now. The private sector, with the huge resources, is only treating 300,000. The whole 3.9 million must go to the private sector, to the public sector. Come TB, we are treating 300,000 people with TB. The private sector is treating zero. I can go on and mentioning those figures, but when you look at the number of doctors, 80% of them are in the private sector, not in the public sector.
But if I got the Ombud correctly, it's not money that is the issue. There are a whole lot of things. For example, it says there is a big issue with the training of our medical personnel throughout the country. And even though they may be employed by the private sector and leaving scores of people at the mercy of the public sector, but there are real and structural problems. There is also the issues of accountability. He is finding it ridiculous that these people, like a lot of the hospitals, for example, have to be accountable to provincial government departments and not to the national department. So he says these are the problems, structural problems that need to be dealt with before we even talk about money.
Oh yes, on that score he's right about structural problems, and I've even taken them to Parliament, to the Portfolio Committee, and this is what he was talking about. Many people believe health is concurrent function, but there are four things that are not concurrent. They are purely provincial, and it so happened that they are the cornerstones, the pillars of a healthcare system. That's human resources. Human resources is a pillar of the healthcare system. As to who gets hired, at what position, who gets fired, is a pure provincial function where even in the law, the minister has got no entry point. For instance, on firing is the MEC, is the CCMA, is the Labour Court, the minister. But people still, the minister doesn't feature anywhere, but people still appeal to me because they believe I can do something. All I can do is to plead with the MEC and say, no, but this is wrong and all that. The second issue is financial management. Many people believe I'm responsible for apportioning budget to provinces. It doesn't work like that. The money goes directly from treasury to provincial treasuries, where the executive council in that province will decide how much they give for each of their departments, including health, of course. The third one is procurement. You heard, the big story last month about the issue of how the Gupta, base, Midiosa, and it happened in Northwest, and people were saying, where was the minister? It's procurement. The people who do procurement.
But then what are you doing about it? What is your party, the ANC, saying about these problems that are making it difficult, if not impossible, for you to deliver? What are your fellow MPs, the legislators in Parliament, saying about changing the situation?
What we have done, if you look at the white paper on NHI, firstly, NHI is for equality. There must be equity in the healthcare system. But we said for it to happen, if you look at the white paper at the last page, we are saying 12 acts need to change all those things we are mentioning about. In other words, those 12 acts need to be amended. We have already given them to the Law Reform Commission, and they've already given us an answer last week, which acts need to be repealed, which needs to be amended, which needs to be consolidated. We have already got the list of those acts. Of course, I don't know them by heart, but one of the things in the white paper of the acts we want to change is the manner in which the relationship between provinces and national in terms of healthcare financing, financial management. And I mentioned 4 things, but you stopped me when I was still at 3. The other is which is always there, is about maintenance of infrastructure and equipment. All those 4, the laws need to change. And that is why the Umbat himself, when he spoke of life is the many, and the oncology, which I saw you talking about, if you look at them, they fall within this. All the problems that have ever been mentioned in the media that has happened in health, they fall within these 4. That's why if you look at the 18 recommendations of the Health Umbat, one of them is that we must review the National Health Act, Act number 61 of 2003. We must also review the Mental Health Act, Act number, I think it's number 17, of 2002.
Is the repeal of that act dealing, for example, with what one doctor friend tells me, the fact that mental health has for many, many years been a poor cousin to physical health?
Well, you see, the act...
Is the repeal dealing with that?
Yes, it's going to deal with that, definitely. Because the danger that happened here inadvertently, Vuyo, is that the Mental Health Act, which was in operation in South Africa at the time of democracy, was passed in 1973. I think it's Act number 18 of 1973. Then in 2002, they said, but this act has got no human rights in it. We need to come with nobody expected human rights back in 1973. And they said, no, we have got to infuse human rights. But they said, something which we realized was dangerous, but at that time they thought they were really doing the right thing. In 2002, they said, but delivery is there at the bottom. It's not at the top. So they took powers which used to belong to the president. There used to be powers on mental health which you couldn't exercise without the president. It was the president's prerogative. There were powers which belonged to the minister, and there were powers which belonged to magistrate. These 3 powerful bodies. All those powers were taken willy-nilly and given to the MEC as powers to be exercised by the MEC, including the power to appoint the Mental Health Review Board, which you had in the case of Gauteng Mental Health Review Board. Professor Makgoba said it's moribund. That body has got powers. They are a quasi-judicial structure whose powers can only be reversed by a court of law. Not the president, not the minister, not any person. But the powers of appointing them and reporting is with the MEC. That's why the professor said, no, this must be changed. This must be reviewed because for whatever reason it was done, it's now leading to disaster. The 1973 Act, they will say when a mental health review board has taken a decision on a mentally ill patient, they cannot implement it until the minister endorses it. That was abolished in the 2002 Act. Now, those are the things that we need to correct. And so you are right. The review means giving back, In other words, we should now accept as South Africans that not everything that happens to be apartheid was apartheid. Some of the things that happened, like giving the powers to do something for vulnerable people like Mental Health Review Board, you need to put it up there on top, not at the bottom. because you need absolute accountability and responsibility.
Minister,
The powers were not even given to premiers from the president. No, not even to premiers, who you will say are counterparts of president in the province. No, directly to the MECs. And that's very wrong. That's why Makgoba wrote that in the meantime, any big change you do in health, don't do it until we inform the minister, even though the powers are still lying with them.
Minister, we've run out of time. There's so many things that we would have spoken about. I mean, the powers that you have and how we'd like those changed. The fact that, I mean, as we heard from one of our reporters, Eastern Cape Department facing a bill of 17 billion rands. You know, there's a
Can
whole
I say
host.
something
There's
about
another.
that?
I mean, Dr. Mufugeng here was talking about the plight of women when it comes to abortions, you know, that cannot be performed. You have doctors refusing to, you know, do their work because they fear that they may be sued. But to anyone who's listening to you and who hears the passion with which you say these things, but at the end of the day, what they're asking themselves is, when will we see the change that is needed?
They will see it. If you read the National Development Plan, they've outlined all the changes that South Africa needs. And they summarize them into two. That there are two things we need to do. We need to correct the cost of private health care because it's exorbitant. But you also need to change the quality of care in the public service. But you need to run one seamless healthcare system with pooled funds for everybody. Then some of these things will fall in place. But I want to specifically answer to this issue of medical litigation, because people don't understand it. They believe a lot of carelessness is taking place. The lawyers who are litigating, many of them were litigating in the Road Accident Fund. When it closed down, they came to health, both public and private. Some of the claims, and very soon we are going to see people being arrested. Some of the claims, like you're saying 14 billion in the Eastern Cape, is if we close our eyes and pay that money. But we are going to pursue people. And some of the lawyers, especially in the Eastern Cape, are going to be arrested because there's a lot of fraud. Let me just give you an example. There's a lawyer who claimed 70 million rand from Limpopo for a botched circumcision. He wanted 70 million rand. And I said, what could have happened to him? Perhaps they amputated this male part to demand so much money. I rushed to Limpopo, I looked for that file. And guess what? No circumcision was ever done to that person. But he wanted 70 million. How was he going to get it? There's a whole range of a network of thugs in this whole system, including the state attorney's office. I must say, I'm not going to be run away from that, who have formed a syndicate. Some of them are in our hospitals because these are huge amounts of money. So we have started the SIU investigating. We're investigating them. That lawyer who claimed that amount, I've reported him to the the board of lawyers. They must strike him off the roll because he's claiming money which was going to be paid to him before syndicate. So the fact that so much money is claimed does not necessarily mean we're going to pay it.